You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Dr. McCunniff, how are you?
I'm very well. How are you doing?
I'm good. All the way from sunny Phoenix, right?
It is very sunny right now, not a cloud in the sky. It was raining yesterday, but that's few and far between. So,
Nice, nice. What is it to be a spine surgeon? I work with many, but you guys have a different club, so to speak. And I want to get into the mindset of that particular job.
yeah, I think there's a couple of just very interesting points, and just what you talked about is probably what I hope is a transition, or kind of what some of the things that in my personal life affect how I am a spine surgeon. But I think for the vast majority of us, it is it is definitely keeping you on your toes all the time. I will be very upfront that I'm an orthopedic spine surgeon, and so that means that I get out of a lot of the head trauma call and things like that some of my neurosurgery colleagues have to take care of. So that's one benefit that I have going for me in my corner from a work-life balance standpoint. But I guess I think that there, just like with a lot of aspects of medicine, you're going to get a spectrum of different personalities. I think everybody that I come across is unique and different and has their own quirks, and I think that that's what makes it makes us unique and different and fun. I if I wanted to hang out myself all day, I would just sit in a dark room like I studied in college or something. But
Yeah.
but I think it's definitely something you are driven for, and at least my personal spin on things is what I learned in residency. So I did my residency at Case Western. So one of the most famous spine surgeons ever, Henry Bowman, who's the father of cervical spine research society, things like that. That was his place, and so he had a lot of good people who learned underneath him, who also stayed and were great mentors to me, like I think he was. And I think there's a lot of pride in the passing down of information and helping the next generation of physicians, which I think can be unique. I won't necessarily name other specialties, but I think that there are some that are like, hey, you know what? Somebody treated me poorly, so I'm going to treat you poorly, and we're just going to propagate this. And that's not necessarily at all how I went through my training or what my experience was. But I think it's constantly evolving. I tell my patients all the time, I have to undo 20 years of bad publicity in spine. I know that when they come in the room, I'm very, I say it like that, and I frame it as, what, I have the benefit of learning from a lot of things that my predecessors did that was maybe not successful, and that's how I'm going to incorporate my philosophy in the way that I'm going to take care of you. And I think that is, I think most people are surprised because they have a lot of misinformation about what spine surgery actually entails. Now, the downside of spine surgery is definitely, yeah, you have to, I'm on call for my patients all the time, and that's just something that you need to come to terms with, I guess, or be acceptable with. And I have a very close relationship with a lot of my patients, and I think that that's not uncommon. As long as if you're a true private practice spine surgeon, I think that is that level of comfort and back and forth. My operative patients have my cell. I want to know, because if I operate on somebody in the ASC, I do an anterior cervical disc replacement or, ACDF. I want to know they got home safe. Are they having, any breathing? These are things that are now being pushed from the inpatient hospital settings to our ASCs, and I think we do them very safely. But with that comes a lot of, I think just an appropriate amount of anxiety, and just making sure that what we're doing is still safe, and that we're maybe shifting the narrative of what spine surgery has maybe been thought of, I guess, over the past 10, 20 years.
Yeah. It's very interesting to me. The specialty itself, to me, requires a certain qualities, I would say, for an orthopedic surgeon.
Yeah.
Not only like physical and, performance wise, but also from the mindset point of view.
Mhm.
And I want to go back with you a little bit into your decision-making process
Mhm.
when you're in medical school, you decided to do a residency. And walk me through a little bit of the logical process that made you make this decision.
Mhm. So I actually just told my MA it was gonna is applying to nursing school today. Was asking me about a lot of this stuff, so it's very fresh. But I tell everybody, so I'm, I guess just a little bit my background. I'm from town in Iowa. I am not I'm the first person in my family to go to college. My dad's side of the family is farmers. My mom's side, my grandpa was an engineer for John Deere, who used to be headquartered where I grew up at. And so, when I was growing up, they were like, well, you're smart, you're good at arguing. You should be a doctor or a lawyer. And so I kind of made it through high school. I ended up, shadowing one of my classmates' dads, who was an anesthesiologist, just happened to be on that day that I had we ended the day with a couple total joints with one of the ortho surgeons. He was very engaging, and when I got to, they're over the, they're all suited up. They've got the saws out there. I'm like, what? This is medicine. This is what I want. This is what I want to do. And so that was kind of what started me on that path. Obviously, things changed a lot from that point. But as I went, I actually, like a lot of orthopedic, doctors will tell you they had some sort of. So I tore my ACL. I went through my whole, journey from the sports side. So when I went to med school, I actually went with a lot of my early research was sports because I wanted to do what I had to go through and that kind of stuff. And probably a lot of times you were supplementing with total joints and things like that. And so it wasn't really until because when I had made it to residency, I hated spine because spine to me at that time was I'm standing 4 feet away. I'm trying to wipe their instruments. I can't see anything that's going on. I'm hoping I can stay awake. I'm, been up studying all night trying to, be ready for these cases. And it was not a good time. Now, thankfully, what I do now and things like that are way different. But it wasn't until I got to residency where I had, I always give a shout out to my mentor. I had a lot of great mentors at Case, but Dr. Nicholas On, who's now the chairman at Louisville, I would tell anybody at that time we had the best spine training as a resident in the country, and I started doing research with him very early, and we became very close to the point where he had really, when I think about academic residency that is gets overshadowed these days when it's so much about production, is you have to be there to teach people or no
Yeah.
one will. And Dr. On was famous for being able to, like, he would let the medical students put in pedicle screws and things like that, and just to show you that, hey, anybody can do this if you have somebody that teaches you how to do it. And so I had the benefit of getting such a good experience from that, and it was one of the first times. I guess it wasn't the first time, but it was one of the times where after I had that, when I was in the different seat than I was as a med student, and I was up there, and it just, the things were interesting to me, and I understood them, I always told everybody, was like, hey, maybe Dr. On and my other mentors were always like, hey, maybe you don't suck at this. You should think about it. And I think that's very much an encouraging thing to hear from anyone, that what you're innately good at is one thing, but also what you put time and effort into and become better at feeds on itself, and it's a positive feedback loop. And I think that's really what ultimately led me to spine, is that I didn't want to be a general orthopedic surgeon, which is a lot of the sports people who come on now, they have published articles on this lately. They're doing a ton of trauma. They're not sports there's 30 NFL teams, and if you're not on that docket, then you're not doing that. So you're having to do a lot of things that maybe you didn't set out to do in residency. And same thing with total joints. Your total joints is such a weird thing because I think it's the only specialty that I know of that your senior partners give you the most difficult things and then take the layup. So it's like kind of a bizarre thing from that standpoint. But yeah, I think I never, even in med school, I didn't think I'd be where I am now. But I think I'm a big fan of a lot of things are about, one, where you're at. Are you prepared to take advantage of the occasion? And I think that was exactly what happened to me. I don't know what set of circumstances led me to do that, but I really enjoy what I do, and I can't imagine doing anything else now.
Yeah, it's very important, something that you just said, the power of mentorship and the people that you have in your life along the way while you're training, because those people can shape your future, and can like imprint in your mind the way you're gonna be as a doctor later on. And I remember in my career, it was the same. I still have a couple of people in my residency that I remember teaching me
Mm-hmm.
stuff that I practice nowadays still,
Mm-hmm.
the same way, because
Yeah.
it had such a powerful influence. And I'm sure in your specialty, this is very important because you
Mm-hmm.
need to have someone who does things well,
Mm-hmm.
teaches them well, and lets you practice well.
Exactly. And one of your points that you brought up that I remember Dr. On telling me at a time was, you have a really good demeanor for this.
Yeah.
You're even key. Like, there, he mentioned another resident who was she's a great resident. She went in but we had a very different demeanor. My demeanor is the same all the time. And I certainly had people that I had interacted with and saw, it's like they behave like a child in the sandbox when they got their toys taken. It's like, no, nobody, it doesn't do any favors for anyone
Right.
to act that way, especially not, in these, in spine surgery, where I'm not trying to say that we are special snowflakes or deserve any sort of extra whatever, but it's just there are high stakes involved, and
Yeah.
it is definitely, I think, to back to your point, one of the things that probably helps me a lot is that's just how I am. I know I'm just even keel all the time. You're not gonna get me too riled up one way or the other, and I think that serves me very well in this field.
Well, yeah, I mean, we all know the operating room environment is a demanding one and a stressful
Mm-hmm.
one for a lot of people. And the way the surgeon understands to react and act with the staff is very important for
Mm-hmm.
everybody's, comfort, I would say, and
Yeah.
performance. So I definitely agree with you that a level-headed, calm individual will make all the difference.
Mm-hmm.
Um, Pete, being successful in spine surgeon is a tough job. It takes a lot of years. It takes a lot
Mm-hmm.
of surgeries, a lot of patience, and I'm sure you've got through, many of your cases
Mm-hmm.
with some memories that not necessarily went well. We all have those. We all
Mm-hmm.
learn from them, and we move along.
Mm-hmm.
Any examples that come to mind?
I will say, I think, I'm I should knock on something. It's not that I've never had anything go wrong by any means, but I will say one of the things that I have always done and always maybe keeps me or prepared in difficult situations is I do a lot of prep. Even the night before, even like I'm going through the plan. It's like when you think of I've heard quarterbacks talk about taking mental reps. It's like the night before I'm doing mental reps and I'm preparing. I make a PowerPoint. So if Y2K happens and the internet goes down, I've got all the images. We're good to go. I have all the memory. So there's a lot of things I do on the front end that I think I would encourage any definitely young surgeons, but any surgeon. I think when you start to get cocky is not the right word, but when you start to get too comfortable, that's when you get bit. And I think that when you can get out of your habits of going through that kind of stuff is when you're leaving yourself up to major complications. So I definitely have had my share of, infections and things like that patients have eventually passed away from, and things like that went on in the OR that, maybe didn't go as I planned. I think one of the times that I can think of, really kind of just, I guess, off the cuff here is that basically I'm doing so one of the surgeries that I do that not a lot of other surgeons do, is what's called the OLIF, or it's like an anterior. So your patient's it's a single position surgery. So they're on their side and I do everything in the front and the back at the same time. So that way you don't need to do a flip where, you do the front part like a normal anterior lumbar interbody fusion. And so that way it allows me it's just more efficient. Efficiency is like, I told all of my team, I have 3 pillars of my spine program: efficient, productive, and sustainable. And sustainable means my life, which I think we'll probably get into. But I remember one of the times I had tried to be a little bit overzealous in getting the perfect position that I wanted for this woman on her when her final exercise would be done, and I took it too far, and the pedicle screw basically broke out the bone of the L4. So that means that I had done all the stuff up front to put the cage in, and I had gotten one side in, but at the same time, I had basically lost my pedicle screw fixation on the one side. And that was one thing that taught me was I think I got away with it because she did well and she was okay. But what that made me do is, okay, what are other ways when you don't have a pedicle screw or you don't have this to work with, when that single thing fails, what's the bailout options? And I think that's where you learn so much in going back and looking at the history of spine and some of the things that they used to do, because those are your options. And I think that was a big, not epiphany, because I knew that all of those things but I wasn't prepared for them, at that day. It wasn't like I had the hooks and wires ready to go like you would have done in the 85. So those things are still legitimate things that you can do in certain situations. And I think that's one thing that case taught me is, one, I need to know those things. Two, I also need to tell somebody that that's a possibility and to have it ready, because surgery is like one of those things where so much of it is preparation, that if you haven't told anybody you might need that, they're not going to be able to, you can't just peel pack that and it's not going to be on the shelf ready for you in a difficult time. So I think that's the other thing about spine surgery. And I think it's probably relevant to a lot of surgical specialties, but if you haven't thought through plan A, B, C, D, E, what happens if this happens, that's where I think the mental reps I do and preparation really comes into play and helps me. If nothing else, I say it's good karma and it saves me from that stuff. But it helps to be prepared in those situations.
No, definitely. I think that's a very good point, especially for new residents and the people that are formed, to have that kind of mental preparation to go into surgeries like that. But that brings me to segue into your personal approach to this and the way you understand to kind of structure your life around your profession, because the way you are in your operating room and with your patients, I'm sure you have those routines in your personal life too. To keep you, sharp and focused. What are those?
So I would say the one thing that, if I had one word to explain everything, the way that I structure a lot of things is efficiency. So I am, I'm a single dad. I have a now just turned 5 year old son who, that changed my life in a lot of ways. And I think realizing I needed to be a father first, and
Yeah.
that other stuff was important, but I was very blessed that my parents were so, I could never fill the shoes that they have done for me to be there for all. So I think part of the narrative is, if you're a spine surgeon, they say, hey, I think the joke is, how do you, how do you keep a dollar from a neurosurgeon or a spine surgeon stapled to their kid's forehead? Well, I'm not okay with that. And I think that medicine, has changed to a certain degree. And I will probably respectfully disagree with some of my more tenured spine surgery colleagues, where uh, the profession is a higher calling than everything else. I don't think that that's necessarily the appropriate way to think about it. And it shouldn't mean that because I'm a spine surgeon, I can't be a good dad or I can't be present. And that means that I need to be really conscious about how I spend my time. So a lot of what I've done in just the way I structure my practice and things like that, one is getting the kind of analogy I have is I started out with a big hospital system. The conversion ratio I had in given what I was given within that system is they wanted everybody to see the spine surgeons, regardless
Mhm.
of what point they were. So I would get a referral. I mean, it was like I have to see 20 people to get one surgery. So a lot of my referrals were, all right, patient refused physical therapy, refer to ortho spine. They have back pain. It's like, whoa, we skipped so many steps in here. Even if this person does have a legitimate, problem, they're not in the ER, they're not in the trauma bay. They can come see me electively, and there are so many things that they need to do before I would ever consider operating on them. So
Yeah.
that means that was kind of my one of the someone who's much more famous in orthopedics than I am, and is somebody that I really enjoy his perspective on a lot of things, is Alex Caro from Rothman. And the way that they have things set up at Rothman, the Rothman model that I really have adapted my practice to resemble is right provider, right time. He was talking about when he was back, maybe in my shoes, and he was like, you know what? I'd see 60 people a day and I'd book 5 surgeries. I was on my second divorce. I was miserable. Like all this stuff. He's like, and you think to yourself, like, what am I doing? You need to be asking, why are you seeing those other 45 people? And I think that really resonated a lot with me. And that's why I have the maybe practice setup that I do, because spine is unique in that, unlike orthopedics, and if you have a P, you're gonna have a PA and ortho. They're gonna do an injection in somebody's knee. They're gonna fail that. Then they come in, they talk to you about doing a total knee or whatever. Spine is different in that nobody in the hospital systems employs the people who do that analogous procedure, which is the epidural injections. Every insurance company is going to make you do an epidural injection before anybody goes to surgery. So you have to be really closely in contact with your pain management physicians. And that was the only, I had to block the first hour of my day at Banner. I would, the rest of my day was basically worthless, because I would, if it wasn't those, first people who had already done those, I wasn't getting enough, surgeries. So
Yeah.
that relationship and understanding the fundamental difference there, which, I wish it was more prevalent, because I think that there's a lot of people who are in my shoes, who are spine surgeons, and they struggle through that. Oh, I got to see 25, and there's pressure to produce and things like that. Well, yeah, I understand. If they're sending you people who need to go to physical therapy, it's going to be tough for you to meet their quotas, because they don't understand
Yeah.
the logistics of spine. And so being able to make that jump to where I'm closely partnered with them, I've been able to improve my conversion ratio to 1 in 3. I see less people. I see 20 to 25 patients in a day, which is probably not a lot. but that means that is these are in-depth conversations where I'm, having, what questions do you have about surgery? The way I frame things all the time is, I don't really do any trauma or emergent things, but I say, hey, I hate feeling like a used car salesman. I want you to go think about this, come back, talk to me about what questions you have. I'm going to write everything down that I just went over with you. I have pictures, all that kind of stuff. What questions do you have right now? I mean, it's in my mind, it's putting the correct amount of resources in the correct area. You're
Yeah.
not we only have a fixed or finite amount of time in a day and so many clinic visits. Give it to the people that I can help. And I think that's, I listen to a lot or try to learn a lot of the things that are done in just the business world in general. I think one of them is you want everybody operating at the maximal level of their training and maximum efficiency. So can I see somebody who hasn't had physical therapy and absolutely I can. But if I was employing myself, I would say, hey, we want you seeing people who are surgery or not surgery. We want you operating on people that you can help, not the other stuff. And I think that's where there's a big disconnect in spine. And I don't know how, Rothman's a pretty big empire. They're doing pretty well with their spine program. I'm very surprised that there aren't more places, from what I understand, that do the model this way. A lot of people will, kind of claim this, where ambulatory surgery centers are now hiring spine surgeons, but that's not the model. The model is the right provider, right time. Somebody has done all the things short of surgery. It's physical therapy, medications, pain management procedures. You don't need to do injections till the cows come home. Just try one and then have the patient come see me. A lot of times we end up, I will send them back for a different injection area, because I think when they get to us as spine surgeons, it's a little bit a higher level of scrutiny, I think. And I guess that's one of the other things that comes with the profession, is that I think we are kind of the last stop in this way, right? And so it's on us people come in all the time, they're like, nothing's helping, nothing is getting me better. And there are some people who that's just, they have other things going on, and that's a whole separate topic, is how, different, I would say, psychological things affect our body and how people present that in pain and symptoms. But those people who also have done all the things short of surgery, we can actually help them. And I think that's a big part of what, it's circling back to the things about doing, on doing 20 years of bad publicity in spine, is nobody has the time to talk to patients anymore. And that's something I make sure that isn't something I'm short on, because I pick up on so many things that are missed. And I'm not amazing, or I'm not like some savant at this. It's just that I have the time and I do the preparation to figure these things out. And I think it helps my patients a ton.
Yeah. Another good point that you made was the fact that basically what we need to do is to think about how we can work to live, not to live to work. You know
Yeah.
what I mean? To structure our day in a way that we give our best to
Mm-hmm.
what's important for us. And most of
Mm-hmm.
the time it's our family, our friends, kids, you know.
Mm-hmm.
So this is a topic of discussion for any successful person, right?
Mm-hmm.
What actually is success for
Mm-hmm.
you? And from what I understand, from what you said, is that exactly that, the fact that, you need to concentrate on your own personal success more than
Mm-hmm.
your professional success. That would
Yeah.
only can help, but personal is more important.
Yeah.
Now, Pete, when you think about your future, what comes to mind? What do you think you want to do?
Well, I mean, I think that I hope that one of the things that and it's a long goal, and we have a long way to go in this too, but um, I just want to be able to, not, I don't know if prove is the right word, but I just feel like there's so many of our colleagues in medicine, whether it's in my profession or I think that we get so bogged down in the workload that gets thrown at us. And because we're all very altruistic individuals, and we want to be able to help people, and we, are going to gut these things out, we have gotten to a point that I think we forget or get too busy to stand up for ourselves. And I think that that's, I can tell you for sure, if I don't take care of myself, I'm useless to everybody. So
Yeah.
if you don't do that at the very least, then you're not going to be happy in what you do. And I think there are a lot of things that I've heard about what job satisfaction entails and things like that. I think the things that come back time and time again for me are autonomy. I want control, and then the other thing is seeing the fruits of your labor. So from an autonomy standpoint, I think health is a big thing for me. One of the things that I've noticed is, like, a lot of times they'll have these, it's like, oh, a vendor wants to come in and book the lunch for you. It's like, okay, normally I have an hour lunch and I go work out, and I'm there. I don't eat. I don't do lunch. I go work out. It's a great break. It's a mental break for me in the middle of the day.
Yeah.
So now I just have if they want to come talk to me about whatever XYZ product they have, they come to the gym and we work out, and they can tell me then. And that way we're both doing something productive. And
Yeah.
at least I haven't given up on, hopefully the things that are going to keep me happy and healthy, because I think a lot of what gets lost in what we do is that, you know, I think night shift work is now a carcinogen from the World Health Organization. I guarantee you, being up for 30 hours on a residency call shift is also probably not good for you. So there's a lot of things that are not good that we're kind of subjecting our best and brightest to, and it's not the golden ages anymore. When we were talking about Tyson earlier, it used to be, hey, oh, Dr. So and so, back in 95, we'd do 3 cases a day. We'd have lunch between. He was making like,
Yeah.
I'm like, well, no, no. I was like, I promise you, I think there's a big disconnect between how much money in the, breakdown of healthcare costs goes to your physician, because it's not a lot. It's not a lot. And so what might have been a long time ago is not the way it is now. And I think that just makes it so you have to be even more particular with your time. And that's where I'm very protective. So autonomy is huge for me, because
Yeah.
I refuse to let things. There are things that are unavoidable, like emergencies that happen in what we do, and that's part of the downside. But it comes with the territory, that. But I won't. I'm not going to sacrifice time with my family to go do, you know, some, I don't know, see some implant for a free dinner. I've been having that since
Yeah.
residency. I implemented a pretty strict no activities on school nights. I don't need free pizza. Okay, I need to go to bed and I need to be able to be ready tomorrow. That's what I need.
Yeah, no, absolutely. I think the point is very good. The fact that, we need to take care of ourselves as a priority in order
Hmm.
to be better for someone else,
Yeah,
for patients, for your staff, for your kids, for your
yeah.
family.
Hmm.
Um, where where you are right now, when you look back into your past, with what you know right now, would you change anything? What kind of advice would you give to yourself?
I don't know that I would change it, honestly. I think that, I guess there's been a lot of these instances that come up, but I am definitely now a believer that I must be incredibly lucky, because I've had a lot of things bounce my way that I probably, if I wasn't prepared for, would not have been able to take advantage of. But um, I think what people can be, what separates people, I think, to some degree, is what are you going to do when things get hard? Because failure is one of the best teachers. I've learned more from failing than I ever have from anything that I just, happened to get right. And so I think that just as you're going through your life, and anybody who's trying to be a physician, or I think this applies to almost any aspect of life. I would teach this to my son is that you're going to make mistakes. What do you do with that? Learn from them. And I like I said, I think I certainly have some four-leaf clover somewhere. But I've had a lot of things bounce my way that I'm not sure I fully deserve, but I appreciate it. So I don't think I would change anything.
Awesome. Yeah, no, it's that's very true. I think you need to be humble, you need to be grateful, and you need to realize that whatever efforts you make in your life, they're for your own sake. Like you make sacrifices and you make, compromises or anything that you want to call them, for your own good. But how can people reach out to you? How can we get more of your story, look up into your work, and maybe be your patients?
Yeah, well, so I have my own personal website, which is McCunniffspine.com. My group that I'm under the umbrella of is Advanced Spine and Pain. So it's ASAP in the Phoenix area. We have a huge reach, so I'm in all over the place. I do telemedicine from to people from Montana, Hawaii, California. I have people who appreciate my input, I guess, from time to time. So any of that stuff can be found on our website. If you just Google ASAP Phoenix, and you'll be able to find me on there. I think any of my my actual email and contact info is on there too. So if there's anybody from any area, if you're a med student, you're a young physician or anything, and are looking for any insights, like I said, I don't think there's anything special about me. There's a lot of, you all can do all great things and can do this it just takes work. That's, as long as you put in the work, you can learn all this stuff. It's not anything special. And I would just encourage physicians in general I think there's a lot of things that they're doing right now. I love what residencies are doing. I mean, forming unions, good, protect yourself. I think that I would support all that kind of stuff. So I'm very happy to see that. And hopefully we continue to not only, give great care to people, but recognize that you also need to take care of yourself, and your family shouldn't suffer.
Yeah, great point. Great way to end this. I really appreciate your time, and I think your wisdom and your advice, and I think the mentorship that you can offer to people that are coming, behind you, it's very important.
Well, thank you very
so
much
Pete.
Yeah, thank you for giving me the opportunity. But like I said, anybody who's wants to reach out and talk about any of this stuff, I'll probably talk your ear off. So appreciate it.
Thank you.
Okay.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.